Greetings, I'm Charles, I'm 54 years old, I'm 6'1" when I'm fully assembled, and weigh about 230 pounds the last time I got weighed in. Today I am going to take a little bit of a departure. I usually do how I do stuff type of videos, but today I'm going to talk about phantom pain, or phantom pain syndrome as it was often called in the past. I guess at some point I just saw one too many ignorant comments or, videos of people that obviously didn't have any idea of what they're talking about. Now, I'm not a physician or a healthcare professional of any nature. I'm not a physical therapist. I'm not a chiropractor. I'm not a dentist. I'm not a nurse. Nothing in any kind of, healthcare profession whatsoever. All I know is the stuff that I've been able to piece together from things I've read, things I've asked a ton of questions about from, other people that I have to work with as far as healthcare professionals and things of that nature. So, as a non-healthcare professional, I'm going to give you an idea of several of the things that I've come across that hopefully will be helpful and help eliminate some of the crazy confusion, I think oftentimes intentional, about phantom pain and phantom pain syndrome. Now, of course, this isn't comprehensive by any stretch of the imagination. A 5 or 10 minute video is not going to but barely touch on things. And my intention is to give you accurate information. Of course, it won't be complete information. There'll be a lot of other stuff that you can find out that I've probably not even touched on at all. So I did make some notes, and since my eyes are getting old and feeble, I got to put some glasses on here. So bear with me. Okay. Well, first of all, I come across what it seems as though there are about 4, possibly more, but what I broke down into 4 different categories of causes for phantom pain syndrome. The first, and the one that you hear a lot, is it's mental. It's all in your mind. Now, my first suggestion, if a friend of mine came to me and said they had a phantom pain problem and their doctor said it was in their mind, I would suggest they just get a new doctor. Now, I will admit that I'm sure there is some of that where it's all in your mind. There's no doubt. There's an experience that I have, for 30 years prior to me ever getting an amputation, I had an ingrown toenail problem. Seriously, for 30 years. And I've had this amputation done many years ago now. And about every 6 months, I got to deal with an ingrown toenail pain. I would suggest that was about the schedule I had when I did have a foot. That's probably is in my mind. It may not be, but it could well be. Okay, but most of this stuff is definitely not your mind. The second category, after mental, is what I've classified as trauma, or trauma-based. And that's essentially where the injury occurred to cause an amputation, either through surgery or an accident or something of that nature. I'm not talking about mental or emotional trauma or anything of that nature. I'm talking about physical trauma to the limb. Now, a couple of things happen with that. Of course, you have pain, you've got a lot of bleeding, you got nerve stimulation, you got all kinds of things that just haven't healed yet, and those things are going to hurt. I mean, we learned that when we were about 3 months old. So, of course, it's much more severe through an amputation than when you tip over when you're trying to walk as a baby. The third one, mental. First of all, we have the mental, the trauma, and then the third one I classify as adhesion. Now, if you try to look this up, you're going to have adhesion pain, and you're going to find a bunch of stuff about things that have to do with your guts and bowels and things like that. Now, I'm not talking about that, of course, because I'm talking about amputations and phantom pain syndrome. So, but it is essentially the same thing. Adhesion, what adhesion has to deal with is the way scars heal. You know, obviously most of the time there is a scar left that can be seen by you. So you know it's not a super clean heal. A lot of times they'll heal and you don't even notice them anymore. But what happens is, and you probably notice this yourself, is you probably have a scar somewhere in your arm or your leg, maybe when you were a child or something, when you had a wreck on a bike or fell out of a tree or, you know, whatever it was, trying to catch a brick that your brother threw at you, whatever it might be. You might have a scar someplace that, you know, that you've had for years and years and years, and it doesn't bother you, but every now and again you realize that you're scratching that scar. Why? You know, it just itches sometimes. Now that is a minor instance of adhesion, and what that essentially is, it causes, when the nerves heal, they're not lined up right, I mean, you know, perfectly, and that's one of the things that causes itching. But in addition to that, as things heal up and the nerves are in the wrong place, and the scar tissue can actually have some connection to other tissue, muscle tissue or bone tissue or whatever it can come in contact with, and it can pull. And especially when you have a scar as big as the ones that most of us have after an amputation, there's lots of stuff for that scar tissue to actually pull on, and that can stimulate a nerve that doesn't seem directly related to even to that area that could be stimulated. It could be from, you know, from a nerve that would have normally stopped at your knee, or it could be from a nerve that would have normally gone all the way down to your big toe. So adhesion pain is the third main one. Now the first was mental, second is trauma, the third was adhesion pains, and the fourth is what I call nerve circuit damage. And that is basically where the nerves have been cut off. And one of the things I liken it to myself is like an electrical cord. Of course, you know, it sends electrical pulses, but it's not in a continuous strip like an electrical cord. But the way I liken it to an electrical cord is when there's an amputation done, it's kind of like the difference between a clean disruption of electrical circuit. That would be from where you just unplug a cord from the wall, like from your toaster or whatever. There's no electricity, there's no concern, there's no flow, it just comes out clean and there's not a problem. And the second, and this is what happens when we have an amputation, is somebody takes a, you know, like an axe or a big hammer or something and tries to cut it in half bluntly, or, you know, without a clean cut. And what ends up happening all the time, you'll see that you got sparks that'll shoot off of it, and there's obviously some electricity that's going around that is basically getting cross-wired, and sometimes you pop a circuit breaker. See, that would be pain, you know, in the human body. Now, one of the things that does happen when we have this type of nerve damage and a huge amount of trauma damage is when things heal, my understanding is these nerves tend to sort of bunch up. Now, that's a thing called neuroma, and it's basically little knots of nerves, and these little knots of nerves can play on each other and send signals to each other out of control. And I'm suspecting that's one of the reasons why we have a huge amount of pain that seems to be coming from an area that obviously no longer exists. Now, one of the other things that does happen is that, you know, we do have the nerves that were supposed to go all the way down to our toes. The nerves are intact up to the point of the amputation, and they can be stimulated. And that can make it feel like something's coming from your toes. In my case, I have a situation where when I had this prosthetic, on my below-the-knee prosthetic, when I got this new prosthetic leg, or this last prosthetic leg, that didn't happen when I had my previous prosthetic leg. And that is, when I put my leg in there and got it locked in, it felt like it was crushing my ankles. And it didn't happen on my previous prosthetic leg, but it happened with this one. It's a little bit different shape. It's hitting nerves at different spots on my residual leg. Obviously, those nerves would have been nerves that would have ran down to my ankles, and it causes pain. Fortunately, one of the coping mechanisms is ignoring it. My understanding is a lot of people just kind of get used to the pain, and at that point they just ignore the pain, and quite frankly, I don't even think about it crushing my ankles until I think about it crushing my ankles, just as I'm discussing it with you. So those are the main things that I have on phantom pain syndrome. And like I said, if somebody is telling you that it's all in your mind, you probably ought to get another doctor. Now, giving you an idea of where these phantom pains come from is would only be giving you half measures here, so I don't want to do that, because there are a variety of solutions, and different people respond better and worse with these things. But I thought I'd throw these up for you. First of all, there's electronic devices similar to TENS, that'd be TENS, and that is an electronic device that controls electrical pulses in your skin, and that throughout your skin and your nervous system. That is something I understand works well for some people, doesn't work well for others. There's heat, like using a heating pad or something, and cold, like using ice or something of that nature. Different people use them in different ways, effective for different people, but less effective for others. There's, excuse me, there's massage. Now, the deal with massage, and this, besides the fact that it just feels good, what massage can do, it can help break down adhesion in scars, which is one of the problems I mentioned earlier that helps cause pain. Scar tissue is pretty tough and rugged, and it's just difficult to work with. But through correct massage techniques, you can soften the scar tissue and cause it to break up in strands that are more likened to muscle tissue, as opposed to just having a big old strip of glue between things. And that can help reduce pain for some people. As I said, you can ignore the pain. A lot of people just kind of get used to it, deal with it, and live with it. There's mirror therapy, mirror box therapy, virtual reality, computer simulations. There's cryotherapy, which is not cold therapy, but it's extreme cold therapy that some people have success with. And there is natural healing herbs. And if you notice, the last thing I have is medications. Excuse me. And when it comes to medications, if you look at, just straight up look at the names of some of these medications, you can figure out pretty quick that a lot of them are just the synthetic versions of some of these healing herbs. So you might actually want to go into consideration of checking at a herb shop, and I don't mean that kind of herb shop. I'm talking about a health food type herb shop. And of course, the medications work differently for different people, but a lot of people do find that different medications can be very effective. So a bunch of causes, obviously, and then there's a whole potload of solutions here that you can try out or try in combination, or just do some research on, take a look at whatever it is. Hopefully you'll be able to find some kind of a combination that'll help you out. And if you got any more good information to add to it, please feel free to leave that in the comments, and so other people can see it. Thanks a lot. I certainly hope that was helpful for you. And I'm not sure if that turned off or not, but I apologize.